Welcome to Autism ADHD TV. It is the place to be for parents and professionals. I'm your host, Holly Blanc Moses, the mom psychologist who gets it. We dive into all kinds of important information like behavior, social skills, and learning. All right, let's get started. Welcome, Dr. Denny Reid. I am so glad that you joined me today.
Nice to be here, Holly.
Okay, so I'm going to introduce you really quick. Dr. Dennis Reid has over 40 years of experience as a clinician and supervisor in educational, residential, and community support settings for people with autism and other developmental disabilities, and has consulted with human service agencies all around the world. His company has employed people with autism and other severe disabilities in a supported work capacity for over 20 years. So welcome.
Thank you.
Today we're going to talk about a really cool topic, and that is increasing happiness in children and adults with autism and or ADHD. And I think this is really important because for them especially, they're more likely to experience symptoms of depression and anxiety. So happiness is definitely a topic we need to chat about.
I agree. And if you think about it, it's really woven into the legal fabric of our country. Think about it. Life, liberty, and the pursuit of happiness. And that pertains to everybody, whether they have disabilities or not. So that and many other reasons, it's something we in the behavior analysis field should be focusing on heavily.
Definitely. Okay, so you and I are just going to chat back and forth about different ways that can increase happiness. And of course, this has to do with all humans, like you said, but we're going to be talking specifically about, again, children and adults with autism and or ADHD. So let's first talk about choices. What are your thoughts about that?
Choices are a good thing. And what I mean by that is, one, the research shows that generally the more choices we make during our routine activities during the day, the more we enjoy our day. Okay. And at least equally importantly, I think when people have choice about how they live their lives or about how they go about their day, they're in control of their life. Versus if someone else decides for them, then they're not in control of their lives. And so one of the things we try to do in our work is make sure we provide choices during the course of the day for people who have autism or ADHD. And also, when necessary, teach people how to make relevant choices so we can make sure they have opportunities to basically be in control of their lives.
I agree. And I think, like you said, feeling like you have some control over life is another way, and I'm sure you're going to agree, to decrease anxiety and feelings of sadness. If you feel like you have no choices, and thinking of an adult neurotypical person, if I was to go through my day and think about all the choices that I make, there are hundreds. Would you agree?
Oh, absolutely. We do a little activity in some of our trainings with direct support staff, and we'll ask them, all right, when I say go, I want you to write down every choice you made from the time you woke up this morning till right now. And when we say choice, we mean you had at least two or more alternatives on something to do or how to do something. And you start thinking about it, and it comes to light. How many choices we make, whether it's like I get up now or I hit that snooze alarm.
That was my first choice this morning. And I hit snooze.
Okay. When you get my age, you automatically wake up anyhow. So, and research has shown that folks with disabilities, have far fewer choice-making opportunities than you or I do, particularly folks with more severe disabilities. So again, that's something we want to actively build into their lives.
Absolutely. And what I found in my work, I haven't been doing this for 40 years, just like 22, but I'm catching up. I'm catching up to you. Um, when I think about choice, it can also open up a lot of other opportunities, such as school participation. When I'm working with a child who's really having trouble like shutting down around schoolwork, it's like, okay, let's bring some choice into this. It sounds easy, but we don't usually do it, right? Do you want to circle this or do you want to underline it? Do you want to point? Which one do you want to start with first? These are all choices that seem small, but can really make a huge impact.
Absolutely. And research would actively support what you just said. When you can build choice into instructional activities, you often see less problem behavior. It also makes doing those activities more enjoyable, usually, for the learner. So, yeah, you make a really good point.
And what's one close to home, last night, my youngest son, who is differently wired, really struggled with getting his dirty clothes in his basket in his room. They ended up all over the floor, the dog's eating the socks. I mean, it was just a big old mess. And what I found was, let me just give him a choice. Do you want this basket at the edge of your bed or do you want it over here in the corner? You tell me what works for you. Well, I think I'd be better if it was by my bed. Okay, let's do it. And it's definitely been better since then. We had a more successful morning with getting those clothes in there. So a small choice can really make a big impact. So I love that. And really, giving choice has a lot to do with us adults and teachers and therapists, parents, being flexible to give those choices. I think that's an important part too. What do you think?
Absolutely. Now, granted, as parents and teachers, sometimes there are some non-negotiables.
Mhm.
But those are, my experience has been, you know, much fewer than they have to be. There are many more opportunities to provide choices. Again, we train staff. If you're having difficulty thinking about the choices you can build in to the daily routine, think about types of choices. Types of choices like what to do. Then you have how choices, how to do it, or when to do it, where to do it. And a really important one, particularly for children, is with whom to do it, because that can make a
Oh,
big
so good.
difference. Now, obviously, as a support provider, you can't always build those choices in very frequently all the time. But at least some of the choices, and if you think about the different types, you can usually come up with at least some choices to build in.
I love it. Okay, so let's talk about notice smiling, laughing, and how we can help see more of that.
Well, I presume you're talking about smiling and laughing indicate that somebody's happy. Um, and generally, the research has shown, and this is common sense, most people, when they're happy, if they're going to show their happiness, they're smiling. They might be yelling while laughing and smiling, versus if they're unhappy, they might be frowning, grimacing, yelling without smiling. Um, and so, it's in one sense, it's very straightforward. In another sense, it's not, because for folks with, say, autism, particularly on the severe end of the spectrum, um, the limited research that's out there indicate that they generally show happiness the same way we do overall. Everybody else does. But there are exceptions. Some folks don't show typical indices of happiness when they're happy. They have other ways of showing their happiness. And so one of the things we have to do is, and I think I'm getting away from your question, so reel me in when you need to, Holly. Make sure we can, accurately identify when somebody's happy or not happy. Because as I think you implied, what we want to see are those indices that, yeah, folks are happy as they go through the day. Um,
Yes, and I agree because not everyone shows it in the same way. You know, I've definitely served children who were very content and happy, but weren't maybe smiling in a way you would think that happiness looks like, right? So understanding what each individual person is looking like when they are most happy and figuring out how to support them in that, having there be more instances, how to arrange the environment, whatever that looks like, to see more of that, I think is really important. Another thing that often comes up in my work is seeing an increase in happiness when we acknowledge and accommodate those sensory differences. What are your thoughts on that?
um, well, it obviously makes sense. I mean, when some sensations are more enjoyable for us, we're more likely to show that we're happy versus other sensations that we find displeasurable. Um, and that's another thing we have to be tuned into. And it starts with, from a support standpoint, accurately identifying when someone's happy or not happy. And in our work, we found, in families, that's usually not an issue. When you've lived with somebody, you know what they do when they're happy or not happy. Okay. And that kind of goes over to support staff. Say for an adult with autism, if that person is in a group home, the longer they have been with the same staff and vice versa, the better the staff are at identifying when they're truly happy or not. But in a lot of support settings, you don't have that long-term familiarity. So we have to take extra strides to make sure the staff can accurately identify when folks are happy or not. And we won't get into that. That gets a little bit technical, but there are evidence-based strategies to do that. So staff knowing folks who have difficulties expressing their inner emotions in conventional ways. But until we make sure staff can accurately identify that, then it's hard for them to go about increasing happiness.
Well, I think that makes a lot of sense. And you mentioned, parents are going to know best. They know their children better than anyone, better than any professional. They know their child. And that just speaks to the importance of communication between the parent and the school, or the parent and any professional that serves their child. This is what makes them happy. This is where they're most content. Because that child may have difficulty, like you were saying, communicating what that need is or what actually makes them happy. So, really, again, emphasizing that communication between home and school. That's going to be a big one. As far as accommodations for sensory differences, I agree. It sounds easy, right? Something that I've noticed is that in the psychological evaluations that are done in schools now, they are really doing a better job at including occupational therapy assessment, at least a screening from an OT, which I think is a great thing. What I've seen, though, is there is a gap between information that we know about the child and what we can do for them in their environment, like their school environment, for instance. If lighting is an issue, will that translate into changing the lighting in the classroom? I don't know. If being in PE is really difficult, are we making it easier for the child to go ahead and have an alternative area to go to, or an alternative type of physical activity, or not even a physical activity if that doesn't work for them? So really being open to not only identifying those sensory differences, but actually taking action and making those changes for them. What do you think?
I think you're right on. And, I've worked with a lot of occupational therapists over the years, but that's not my area, obviously. Um, But one of the things that behavior analysis has to offer there is, we have systematic preference assessments that we can take those and look at. Okay, does a person, prefer this type of lighting in a room versus a different lighting in a room? Or what levels of ambient noise does a person prefer versus non-prefer? We have ways to do that. It takes a little time and effort, but we can systematically assess that. And once we assess that and we accurately identify someone's preferences, then you're absolutely right. We got to find a way to build that into their day. And that can be done as well. And, it kind of gets to an issue where we see some behavior problems. Say it's in PE, and it may be just the ambient noise in the gym is just so aversive that someone engages in behavior problem, trying to escape it or at least cover up the noise. And some folks will approach that. We develop a behavior support plan and don't let the person escape the environment, so that problem behavior doesn't get reinforced. But that's not addressing the cause of the problem behavior. The cause of problem behavior is something is extremely unpleasant for the individual. So if we can change that one way or the other, do PE in a different setting where the noise isn't quite so loud, then there's no, then we don't have to deal with behavior problems. So I agree. We really need to attend to that and attend to that, from my perspective, a little bias, in evidence-based ways, so we make sure we do what works.
Yeah, and I agree. And anything that you can change it. So, there, for instance, working with someone who did not like the overhead lighting in my last office. So, of course, the light would be off when this person came in. His favorite music would be playing to make him comfortable. So those things that we can possibly change, we'll change it. Like, that's how I think it should be. Instead of, okay, you're gonna be in PE, period. That's the expectation. That's it. So it's like, okay, no, that's not gonna work. So I see that there is a nice change and, increased understanding about accommodating for someone's sensory needs. Of course, we need to do better. We always need to do better. We want to keep moving in that direction to serve that person. And I think we really need to pay attention and learn from that child, what do they need? And we don't want them to be uncomfortable. It doesn't make sense. This world often is not built for them, unfortunately. So there are some changes that we definitely need to make in the environments. Okay, incorporating interests. What do you think about that one?
Well, my terminology may be a little bit different. I look at it as preferences.
Mhm.
And again, we have very good evidence-based ways to assess preferences among people with all kinds of skill levels. But it doesn't do any good to assess preferences if we don't then build on that information. And it gets back to what you just said. We can make changes. And one of the most enjoyable pieces of research I was involved in, as well as in clinical practice, is when we would go about embedding preferences or access to preferences into someone's day, whether it was in the classroom, supported living situation for adults. Because once you do that, then you start to see, folks having a good time. You see more smiles. You hear more laughter. So it's not much sense identifying interests and preferences if we don't attend to them. But often we have to take specific steps to allow them to have access to their interests and preferences, during the routine situation. But we can do that. We just have to take the time and effort to do it. And
Exactly.
the payoff is great because you see people happier, and you get much less behavior problems.
Definitely. And I see what you'll see typically, and I think you'll agree, is we usually see problems come up or concerns in the classroom or wherever that is when we hear about behavior problems. Like, that's when everyone starts paying attention, right? And so looking at that in a way where, how can we figure out what this child needs? Clearly, there's not being a need met here, if we're seeing this. And again, are we willing to make those changes to meet that person's needs? And I think that's a question, we need to keep coming back to. And I'm hoping the answer is yes, like you are. Thank you so much for coming on with me today. I am such a big fan. I nerd out on your work all the time. So I'm so excited that you came and were really doing this great research in the area of happiness. And so just to review, we talked about choices, noticing when someone is happy and content, and we want to do more of that, making sure that we are accommodating for any sensory differences, and making sure to always incorporate those interests.
You've wrapped it up very nicely, and it's been enjoyable interacting with you. So thanks for the opportunity, Holly.
So, Denny, I know a lot of people already know about you that are listening and watching right now, but how can they learn more about your work and your books?
Well, I do have a website, www.DennisHReidAU for author.com. Reid, R-E-I-D. As far as the topic we've talked about today, thanks for bringing it up. We do have a book, Promoting Happiness Among Adults with Autism and Other Severe Disabilities. The easiest way to get that, if one's interested, is through Amazon, or someone could email me at drcba@outlook.com, and I'd be glad to email information back or whatever, if that helps.
Well, thank you so much again for your time, and hopefully we'll be talking again soon. Thank you for joining me today. Don't forget to click that subscribe button so you don't miss any future episodes. If you like this episode, please share it with someone. It may just be what they need to watch today. If you're a parent, I'd love if you came on over and joined our Facebook group, Autism ADHD Group for Parents. If you're a therapist or educator, come on over to our group, Autism ADHD Group for Therapists and Educators. You're going to find those links right down there in the notes. Thanks so much, and I can't wait to see you in the next episode.
All content provided is protected under applicable copyright, patent, trademark, and other proprietary rights. All content is provided for informational and educational purposes only. No content is intended to be a substitute for professional medical or psychological diagnosis, advice, or treatment. Information provided does not create an agreement for service between Holly Blanc Moses Crossvine Clinical Group, the interviewee, Holly Blanc Moses LLC, and the recipient. Consult your physician regarding the applicability of any opinions or recommendations with respect to your symptoms or medical condition, or the symptoms or medical condition of your family member. Children or adults who show signs of dangerous behavior toward themselves and/or others should be placed immediately under the care of a qualified professional.